following paid program does not necessarily reflect the views of this station, its staff, or Clear Channel Media and Entertainment.
Live from downtown Honolulu, it's The Moving Body with your host, Dr. Bernie Portner of Portner Orthopedic, recognized as Hawaii's leading sports medicine and orthopedic specialist. And now, here's your host, Dr. Bernie Portner.
Good morning, Hawaii, and welcome back to The Moving Body. This is Saturday. Let me check the date. This is always an issue. My watch says the 5th, but I'm sure it's the 6th. The 6th of December, 2014. So if that's true, we're live, and you can call me here right now, 521-8383. And I'll try my best to answer your questions as I always do. Try, I should say. The lines are open now. Later on in the show, it's often busy and hard to get through, so don't hesitate. If you have a question and you live on Oahu, 521-8383. If you're on an outer island or indeed on the mainland listening through iHeartRadio, streaming live, you can call toll-free 1-888-565-8383, and we'll take your calls. The calls are what makes this show what it is, so I rely on you guys to come up with some good questions for me. Well, we're well into December here, another couple of weeks, and people will be going away on vacation for Christmas and New Year's. It's a problem in my field because December, especially towards the last half of December, is a difficult time to get therapy and to get consults with other doctors. Everybody's taking time off, and but people are still getting injured. And I know my physical therapy department is depleted for much of the remainder of the year. And when I send people out to other facilities, they too seem to have trouble getting appointments. But we're doing our best, and we have plenty of well, I shouldn't say plenty, but we have open appointments throughout the month for doctor visits. So if you're having a problem with your arm, leg, neck, or back, or a sports injury, or a car accident injury, or work-related injury, or any sort of ache or pain, we can see you at the office. I'll just give that number now, 596-7300. So if you're too shy to call and talk to me on the show, you can call the office, probably get a voice message right now, but leave a message, and we'll get back to you probably Monday. We were having another glitch in our phone system. It's always something, but it was very brief, but I apologize to those that tried to get through and couldn't. That only lasted about an hour or two. We're dependent on this computer system for our phones nowadays, and it's never perfect. I see I have my first caller, Rose. I love that name. Rose, go ahead. You're on the air, and thanks for calling.
Hi, Dr. Portner.
What can I do for you?
I wanted to know about your office. The office you're going to open at Couple Lake.
Yeah.
When is that going to be?
When?
Yeah.
I don't have the exact date. It'll be early January, hopefully.
Coming January, right?
This coming January, and my associate, Dr. David Bro, will be manning it. It'll just be one day a week to start with, to see how it goes, and we're all very excited about it. I don't have the address where it's at, but I'll have that for you soon. And
so
the
main office to get the address?
Yeah, you call the main office for all of the clinics, because I'll have three.
Okay.
So the main office is the one, and they'll tell you how to get there and where it is and give you an appointment. I'm sure we won't be all that busy right from the start, but we feel we're seeing enough patients from that end of the island that we think that we can, at least part-time, have a successful clinic out there. So we're going to give it a try.
Will he have the same treatment as you?
Yeah, exactly.
Exactly the same?
Yeah, because we trained in the same field, and he's been training under me now. It's same. For some treatments, you'll still have to come to the main clinic in town because we won't have the fancy equipment. We'll have some of the equipment, but the main thing that you want from my clinic, whether it's in town or Kaneohe or Kapolei or wherever it is a proper diagnosis. And for that, we don't need much equipment. For that, we do it the old-fashioned way. We use our hands. So the diagnosis, that's the services that we'll provide. And there'll be therapy out there and some injections and some tests. But the big-time tests where I use the fancy C-arm, the X-ray machine, that everyone has to come into town for. Even the people in Kaneohe have to come into town for.
Oh.
Yeah, because we can't, it wouldn't be practical to have that expensive equipment everywhere. But that's a lot better than having to come in 3 times a week.
Yes.
It's just a one-time shot usually. So, yeah, we're all very excited about it. Why, you live out there?
Yeah.
Uh-huh.
And I'm really happy that you moved to
Yeah, what do you think? Have you been talking to people about it? Does it sound like it's going to be well received?
Yes.
You think it's needed out there?
Yes.
All right, well, here we come.
Thank you.
Yes.
Okay, I'm going to be making my appointment.
Yeah, you call the office anytime. If they don't answer, if it's a weekend, just leave a message and someone will get back to you.
Okay.
But we'll have the particulars ready for you very soon.
Okay, I'll be listening.
All right, Rose. Thanks.
Thank you.
Have a nice weekend and a nice holiday season. Yes.
Bye.
Thanks for calling. Bye-bye. Right. I guess I mentioned last week that we finally took the plunge, and we're going to at least try the waters. We're subletting some space in Kaneohe, one or 2 days a week. We'll start with 1 day and see how it goes. But I've gotten a lot of encouragement from different sectors of the society, of our community, from patients like Rose, and from doctors who are out there and look for someone to refer patients to, and insurance companies and attorneys, and so we'll see. I just wrote a letter to my nephew on the mainland, and I told him, I'm just turning 65 this coming year, and I contemplated retirement after all, 65. But I've been at it strong. I've never taken a real break since high school, really. And I considered retirement, and instead I didn't. And I moved to a new clinic, and I'm starting a new clinic now in Kapolei, and I'm starting a new weight loss program that I'm learning about and very excited about. I feel like a young man. And I'm also, I just got back from San Francisco, where I learned a new procedure it's new to me. It's been done in Europe for 10 years, and it's very popular in California. The doctor who taught me has been doing it there for about 4 years. But in Hawaii, we have it, to my knowledge, no one doing it. And the company representative that makes the equipment out of Germany is actually flying over to Hawaii, not this week, but next week. And I have a couple of patients lined up, and we're going to make a little medical history here in Hawaii and do the first fat-derived stem cell treatment for osteoarthritis. And it's used for other conditions as well. But I'm very excited about it. I don't make any guarantees with this treatment. In fact, I make no guarantees for any treatment as far as that goes. Although it is safe, I can guarantee that, or almost. If I can guarantee anything, I can guarantee it's safe. But I'm very excited about it, and the patients that are lined up to have it are sort of desperate. They've tried everything for their osteoarthritis, and they're facing surgery, and they're too young to have surgery. So they're going to try this treatment and let me do it for the first time, although I've done the same shot many hundreds of times. It's just the harvesting of the fat cells that I haven't exactly done, but I've watched it and I've learned, and this guy is coming from the German company to walk me through it again. But I'm very comfortable with the procedure. Anyway, kind of exciting to be part of new things happening in the new year, and it beats retirement, I suppose. 521-8383, the lines are open. Give me a call if you have any questions regarding arm, leg, neck, or back pain. And by the way, I don't have the address of the new clinic in Kapolei yet. I mean, it's known, but I just don't have it on me. But I'll get that for you guys next week. We were talking about osteoarthritis of the knee as candidates for this stem cell procedure. The theory being is that you can take your own stem cells. You know, people think of stem cells as coming from, placentas or cord blood or other products, but actually you can get adult stem cells from your own body. And it turns out that fatty tissue, of all places, is home to many stem cells, a high concentration. And we aspirate some fatty tissue from under the skin, not much, and then spin it down, and then take out the layer in the tube that has the stem cells and put it into the joint with the hope that these stem cells, means it's, imagine a tree with a stem, and then it branches out to many different branches, and those branches branch out. Stem cells have the potential to become many different types of mature cells, differentiated cells, cells that are muscle, or cells that are cartilage, or cells that are bone, or cells that are skin. But a stem cell has the potential to become any of those things. And when you inject those in the joint, you do so with the hope that they'll become cartilage cells. And it does seem to work for some people, so we're going to try it. I wanted to talk a little more about other treatments for osteoarthritis, but I see I have a caller. I'll get back to it. This is Joan. Joan, go ahead. Thanks for calling. You're on the air.
Hi, I love your program. I listen every week.
Thank you.
Anyway, I'll be speedy. I complained of my legs for about 7 or 8 months, and the doctor said, there's nothing wrong. I mean, I could hardly walk. They hurt really bad. Oh, there's nothing wrong. There's nothing wrong. Good legs. Just keep walking. And finally, about a month or two ago, I went to Acupuncture, and she's very good. I hadn't been to her for quite a while, and she started working on my back, and she said, you know, something's wrong with your spine, because every time I press a certain place, the pain shoots down your legs. Well, anyway, to make a long story short, so I told the doctor that it said nothing was wrong. He'd given me some Balta. He told me it was in my head. He said it was nothing, and I couldn't take the pills, and blah, blah. Anyway, so finally he took an MRI, and he said I have spinal stenosis, 3 bulging discs, and a lot of inflammation where I'd fallen off a tricycle at like 70 riding. Uh-huh. But anyway, so now down the line, I finally wait 5 weeks to see a back doctor, which I was hoping he would say, I will do something to get you out of pain and maybe do an epidural. I've read a lot on the internet. No, you have to go to 6 weeks of physical therapy. Am I on the right place? Because the swimming physical therapy, yesterday I went and I cried for like 5 hours after. I was in such pain.
Where do you go for your medical care that they make you wait 6 weeks?
It's a big one in town.
Is it a Kaiser situation?
No, the other one.
So
anyway, am I on the right road?
No, you're not on the right road. First of all, when you have pain and you can't walk and you go to the doctor and they say nothing's wrong, you got to go to another doctor. That's just terrible. When you say that, I'm embarrassed for my whole profession. I'm embarrassed to be a human being when I hear that. nobody can tell you that nothing's wrong if you got pain. So you know that that's not the right doctor to have.
Well, yeah, I did get sent then to I asked to see a back doctor.
Yeah, fine, and you have spinal stenosis. I'd buy that. But why wait 6 weeks if you're fine?
I know. I can't even tell you. If I told you another story, there's not time for it, but I'll call another time and tell you.
Joan, I've heard all the stories there are to hear. I know this.
But what should I do now? Should I continue with this swimming? It feels so
not
good.
if it makes you cry.
Well, it's only been the second time, and you've got to realize I haven't really done anything but walk my dogs. So
yeah, but how far can you walk before you have to sit down and rest?
Maybe a block and then.
And when you sit down and rest, the pain goes away?
No, I'm in pain. I am in pain almost all day.
Because spinal stenosis typically gets relief with sitting. And it's worse with standing or walking.
Well, it is, yeah. If I sit down and I just, do paperwork and stuff, it's much better. But I can't lay on my back. I can only lay on my side.
Well, first of all, and you've had this for months.
Months.
Yeah, so I think it's not a bad idea what you read on the Internet. An epidural is certainly worth a try. It's not likely to be curative, but it will relieve your suffering, and it may do so for months on end.
Oh,
and then
he did promise that.
Yeah.
Well, he didn't promise it. He said, but you have to do 6 weeks of the water.
Well, that's just nuts. That's just nuts. I don't know what rules are being followed there, but it doesn't make sense to me. Would you have some sort of HMO or?
Oh, yeah, he's the one that sent me there. Okay. I'm gonna come and see you. Actually, I
think so.
By my.
Yeah, I think so because I can't promise the epidural will do you much good, but it won't harm you, and it's likely to help more times than not, and it's a good first step. And if you're, spinal stenosis is a very common condition. If you listen to the show, like you say, you've heard me talk about it a lot.
Yeah.
And in the population over, let's say 45, 50, it gets more and more common. It's very different from a disc problem, which opposite, sitting hurts, standing gives a little relief.
Yeah.
With stenosis, it's the sitting that, as you know, it's the sitting that gives relief, and the standing that you can't handle.
Mm-hmm.
And of all the conditions of the back that cause pain in the back and or down the legs, spinal stenosis is the one that's best, has the best outcome in terms of if all else fails, surgery will do the trick, and the surgery doesn't have to be too involved. So I'm not suggesting surgery, but I'm suggesting you don't suffer so much for so long unnecessarily. And if you're not walking,
I walk the kitchen, feed the dogs. Right?
Yeah, but you're not walking much, and you're limited because of the pain, and therefore your general health is going south. Right? And you can't afford to do that for much longer. So you're welcome to come and see me or see somebody that will act on this.
I'm going to do that.
All righty, Joan.
Thank you so much.
Thanks for the call, and best of luck with this.
Bye-bye.
Bye-bye. Let's see, I have another caller. Looks like Troy. Troy, go ahead. You're on the air, and thanks for calling.
Good morning, Dr. Portner. Calling from Kauai.
Yes.
My mother spoke with you last week in regards to my condition or illness, diagnosed with spinal degenerative disease or bone spurs in my neck.
Right.
And I just wanted to see if, what your experience has been working with people who have the same condition and possible treatments and what kind of...
Well, if I recall, even if I don't recall, I know what I say about spurs in the neck is sometimes they're there incidentally, and sometimes they're there as at least part of the cause of the patient's pain complaints. So some people have neck pain, and you get an X-ray, and it shows spurring, and the doctor puts 2 and 2 together and comes out with 4. that you got neck pain, you got spurring, therefore the spurs are causing your neck pain, but that's not always true.
Mm-hmm.
So the first order of business is to make sure that spurring is indeed the cause of your pain. It may be or it might not be. But assuming that it is for a moment, I don't recall, have you had any specific treatment for your neck pain so far?
Well, yes, I basically have been going to physical therapy.
And have you had traction in physical therapy?
Yes, yeah, traction.
And was it useful?
Actually, with the manipulation, the heat, and then a little bit of massage and traction, it seemed to take the edge off the pain, and I left feeling a little better when I came in.
How long
does it last?
How long does it last?
Yeah, a few hours, and then the muscles start to spasm.
And what about a home traction unit? Do you have one of those yet?
I don't have a home traction unit, but I have like I put a towel around my head. I kind of follow my physical therapist's suggestion of making like a makeshift one.
Well, you can do that, but they make pretty convenient and affordable home traction devices. And there are certain neck conditions that are well managed with a daily home traction treatment. So if traction makes you feel good, then you should purchase. Sometimes insurance will cover it, sometimes it won't. They range in cost. You can get a simple pulley system with a cord and some pulleys and a contraption that fits over your door, for example. And you can do traction, for, I don't know what they cost, $40, and you got your own home traction device. Or you can spend, a couple hundred or several hundred for different types of home traction devices. But it's well worth your investment, because if traction helps, you should do it all the time. As far as more definitive treatment, because it may not give lasting relief, although in some cases it will, then your next step is to consider possible injections of various types that are generally safe and often effective. If there's a spur, really, do you have severe pain down the arm?
No, no severe pain. Just for the last 6-7 months, a chronic stiff neck to where a point where I can't move. I wake up with a stiff neck all day.
In my experience, a spur becomes a real problem when it pushes into the nerve and causes lancinating, severe pain down the arm. Then a surgeon goes in and carefully removes the spur off of the nerve, and that's one of the cases where a spur is really relevant. In your case, I know you got spurring, and I know you got bad neck stiffness, but I'm not sure the two are related. So do a lot of traction. Do it on your own. Do it at home. Don't take no for an answer. Find a device. Make the investment. And then maybe ask to see a specialist that can talk to you about various types of injections to try. You shouldn't have to live with this for so many months without getting through the list of safe non-surgical treatments. It's not a long list, but you haven't really scratched the surface.
Right. Well, my MRI and even X-rays show that it looked like the space between my discs, like maybe second, third, fourth, fifth.
Yeah. Well, that's
down, and it's very thin, and like when I move my neck, I can hear cracking. Like I was fine 7 months ago, and then I woke up with a stiff neck, and it's just gotten worse and worse.
And I'll tell you something else, Troy. 8 months ago, before you had any problem, if you had taken an MRI for some reason of your neck, it would have looked the same. So don't be confused. All that loss of disc spaces, all those terrible findings that they see on the MRI pre-existed your symptoms. And if you have a successful treatment of one type or another, whether it's daily traction or injection of one type or another, and you recover and you feel better, and they repeat the MRI, which they wouldn't, but hypothetically, it would still look the same. So there's no good one-to-one translation between how severe the neck pain problem is and how nasty the MRI looks. Sometimes there's a lot of pain with a pretty good-looking MRI. Sometimes there's a nasty-looking MRI with not too much pain. There's no correlation. Don't focus on that. Focus on how much discomfort I'm having, how much limitation in terms of range of motion of my neck do I have, and more important, how much limitation do I have in terms of the activities that I would normally like to be doing pain-free, and see what you can do. The understanding of neck pain, just like everything else in orthopedics and in the universe, frankly, our understanding is pretty sketchy. So don't think that doctors really know what the heck is going on. We're in the dark almost as much as you are. Mm-hmm. And what you have is a situation where you have neck pain, excuse me. Sorry. Where you have neck pain, and there's a short list of what the problems could be, and there's a short list of what kind of safe treatments that there are available to try. And that's what you're going to end up doing, is trying these various treatments to see if one of them can help you. It's almost a process of elimination. All right? So just don't get stuck on the MRI, and don't get stuck especially on the spurs or on the loss of disc space heights. Yeah, you got that, and yeah, it's probably related to your complaint somehow, but it's not as related as you might think. And the problem, by the way, is maybe not as insurmountable as you might think. Nothing's really been done. Get traction every day, even twice a day, and do that for a while. That might be your answer. And on top of that, see a pain specialist or me or somebody that can offer you other types of shots and so on.
Right.
All right.
Because I get the body work, I get massage, and
well, that's going to be a temporary relief at best.
Right. It's like no matter what I do, even if it looks a little better, it gets stiff again very quickly.
Well, listen to my advice. Don't dwell on the past. Listen to my advice going forward into the future, into the new year. Get a traction device. It's not difficult. A lot of people have them. Get one, and talk about some shots if necessary. Okay.
Okay. What about the stem cell? Has there been any
stem cells for this?
Into spine,
yeah, it may have a role if you have. Thank you. I just got some water from my lovely engineer. Hold on, I'm gonna take a sip of water here. I'm dying. Yeah, 1 second. Let's see, I got this elixir here.
We don't need you.
Fixes everything. Hold on. It cures hoarseness. Anyway,
yeah, get glass of water.
You can't beat water. So, yeah, I don't know if I'm getting my message through to you.
No, you are. I'm just trying to explore while I have you on the phone, like your thoughts. You just talked about stem cells.
Yeah, so stem cells may have. In fact, the doctor I learned the stem cells from, she uses these for bad arthritis of the small joints of the neck. If that's the case in your situation, and I don't know if it is, but if it is the case, then that may be an option, but it's certainly not the number 1, 2, or 3 option. Also, I don't think she's doing this, but I've read of people getting stem cell treatment into worn out discs. Mm-hmm. But that too is not 1, 2, 3, 4, 5, or your 6th option. That's way down the road.
Okay, with injection options, no one's even offered me that. They said, unless I get severe pain down the arm.
Yeah, no, well, I don't agree with that. But go ahead. No one's going to want to give you a shot until you exhaust less invasive treatments. It is your neck. So try a lot of intensive traction, okay, Troy?
Okay, Doctor.
All right. Have a good holiday season. I hope you feel better soon. And worst comes to worst, you get on a plane and come see me.
Sounds good. I'll make the email before then. Thank you.
All right, Troy. Take care.
Bye-bye.
Bye-bye. Let's see, another caller. George. George, go ahead. Thanks for your patience. You're on the air, and thanks for calling.
Hi, thank you.
Sure.
It turns out in my life right now I'm physically active doing several different things. And at my age, 90, I'll be 90 in May, and my hips and knees are kind of worn out, making it pretty difficult.
Yeah.
And but I'm real active, and I couldn't get much help on Maui, as I've been working on a long time. But I just changed to Humana, and I'll have to just see how that works out. But
you mean there'll be different practitioners available to you?
Yeah. Well, the bottom line is one thing I wanted to ask you, if you happen to know orthopedic surgeons that are on Maui.
I think Dr. Soma is on.
I have that name, but I don't think he's with Humana. I'm going to call him.
Yeah, you have to call him and see. I'm sure there must be others, but I don't know.
Yeah.
I don't know for sure. And I
could
don't know
briefly name off some names just to see if you might be familiar with?
Go ahead, but I doubt if I'll know them. But go ahead, maybe.
Well, what they have right here is Darren Awaya, Darren Igami, Douglas Ching, Vivian Chang, and Paul Lamberti.
I don't know those people.
Okay.
But something else occurs to me. There's a Dr. Mitsunaga over here at Queens in Honolulu, and I think he goes to Maui every once in a while. And sometimes you can go outside of your plan. Maybe you're 90. You're not using Medicare.
I'm on Kaiser right now. I've been on Kaiser a long time, and I'm dealing with now. I'm so active. I've had some serious falls, and
or maybe you should do more in the water with your hip and knee problem, and you're falling.
Oh, I've had several surgeries in the past 2 years, and but no, I swim a lot. I'm back now that I can swim again. I'm back up to a mile swimming.
Oh, good for you. No wonder you're so healthy and aging gracefully.
I'm great from my belt line to my neck. I'm fantastic. Everything else is shot to hell.
Well, there's keep up with your swimming. And research these various doctors. Maybe the stem cell business might be just the ticket. Because we don't know. Let me try it out for a little while first. But there is hope for the geriatric population with worn out joints that stem cells may prove useful. It's a little too early for me to make any firm statement there, but I'm optimistic actually, and I'm a big skeptic, so there's something to be said for that.
It seems to me I'm going to have new. I did get one new. I got a left knee replacement in May.
And how'd that work out?
It for what I do, it's painful. And
you're not happy with the procedure, huh?
No.
Not really.
I have to say, but it's not no. But I've just started outrigger canoe paddling.
Oh, good.
And I got it in my mind I'm going to race when the races start.
Oh, good for you. It's an inspiration, George.
But I really need new joints, and I hate to leave Kaiser because I have two wonderful cancer surgeons there. I got to do something about my joints, so I'm going to see what Humana can do.
Yes. Okay, well, good luck with this. I don't have that much to talk about in terms of Humana.
Yeah.
They got a narrow list of participants, I think.
Yeah.
But,
Well, we'll see. Anyway, I would love to be able to surf again.
Yeah.
Do you think it's possible?
Well, all things are possible.
The angularity you need to be able to jump up and...
What about stand-up surfing?
Well, I'm glad it wasn't around when I was surfing. They don't mix. We'll try it, but
I have other patients in your category, George, that they surfed all their lives, and then they got a bad back or bad knee or joint. They couldn't pop up anymore, and they were really depressed about it. They couldn't
Yeah,
surf.
I know.
And I convinced them to do stand-up because you don't have to pop up. You're already standing.
Yeah.
And you like to paddle. And as soon as you catch a wave, and you catch waves before even the longboarders, you catch all the waves.
I know.
And it's a blast. I did it yesterday with my daughter, and it was on the South Shore. There were no waves to speak of. It was a beautiful morning. We do dawn patrol, and it was low tide. And sure enough, we paddled over to a place called Paradise, of all things. And there was a little bump every once in a while, and I actually caught rides on my stand-up. But you're outside, and you're getting exercise, and you get the stoke of catching a wave from time to time. So I wouldn't poo-poo it. I had a patient passed away, a very famous guy. His first name was Ricky. Big-time, big wave surfer in his day. And he had a neck problem, and he couldn't surf anymore. And I said, Ricky, do the stand-up. And his response was just like yours, that he had disdain for it. He didn't like what it looked like. He says, it looks like they're standing there and want to go to the bathroom, And God bless him. And he's since passed. But I could never convince him to try it, and I think it was a mistake. Anyway, I'm not suggesting you do it because I don't know you well enough to know if it's safe. But you look into it. Try to get your body repaired. Don't cross stem cell treatment off the list.
No.
And you might have to spring for a out of network consultation at least. And maybe go see Dr. Mitsunaga. I'm pretty sure he comes to Maui. All right?
Well, I thank you for that name. I'm going to look into it.
All right. Thanks, George. Good luck to you. Have a nice holiday season.
You too. Thank you.
Right, take care. Let's see. I think Jane is next in Kaneohe. Jane, go ahead. You're on the air, and thanks for calling. Jane, are you there? No. Let's see. I have... is this Glenn? Glenn, go ahead. You're on the air, and thanks for calling.
Hi. I just recently had a bone density test, and it came back with -3 osteoporosis. But I'm in my mid-60s, and I don't have any pain. I'm pretty active.
Osteoporosis is painless.
Yeah, well, I can run, jog. I have no pain whatsoever. I'm a vegetarian. So I was just wondering, what should I be doing to correct this?
Well, the answer to that question is not well known. It's different opinions about that. You're already running,
right?
So that should have protected you from osteoporosis.
Mm-hmm.
The fact that you're a vegetarian may have something to do with it. Do you make sure you get enough protein?
I try to.
That's one of the things about being a vegetarian is you have to go out of your way to get enough protein. People who eat meat eat too much protein. Do you eat eggs, by the way?
No dairy.
Yeah. No eggs, no dairy, no fish.
No, I do eat fish.
Ah, good. So make sure you eat fish. That's one of the best sources of protein.
Okay.
It also has calcium, especially if you eat the fins, and the bones. And vitamin D, do you get sun, or are you keep yourself out of the sun?
No, I get plenty sun, and I'm taking this calcium supplements now, and I'm drinking almond milk.
Yeah. So I don't think it's a dietary problem, to tell you the truth. Now,
Okay.
you can always have blood tests and check levels of vitamin D and so on, and levels of calcium. I assume your doctor has done that.
Right.
And then the exercise part you're doing, I suppose there's always room to do more.
Okay.
And then they have various medications to take by mouth and injection that supposedly improve the density and perhaps the quality of your bones.
Well, I want to stay away from things like Fosamax. I heard it creates fractures more than anything else.
Yes, well, I don't know that I'd agree with that, but I do agree with your caution. And there's also the school of thought that believes that osteoporosis is overtreated in our society, that it's not a disease, that it's part of aging, it's what happened.
Right.
And like you say, it's not painful. It statistically makes it more likely that you'll have a fracture if you fall, for example.
Right.
And this bone density test, did it show osteoporosis all over, or just in the hip, or just in the spine, or just in the wrist? What kind of test did you have?
You lie down and this scanner goes over your spinal area.
Yes.
And your pelvis.
Yes.
That's it.
How much running do you do?
Every day at least a mile and a half, 2 miles.
And how old are you?
65.
Oh, right, you mentioned. And why do you stop at a mile? Is that, or a mile and a half? That's just.
Well, I just go by time.
Yes. And And are you running on grass or on cement or?
At a track.
At a track.
Yeah, on a high school track.
And is it a paved track or is it just a hard earth?
It's a paved track.
Yeah. Paved with macadam with a blacktop, or paved with something cushiony?
Cushioning.
So one thing you might do gradually is try running on the road or on a harder surface, because what will build bone is impact.
Okay.
And if you're running on a cushiony surface with cushiony shoes,
right,
your impact is blunted.
Okay.
And therefore the stimulation to the bone to grow stronger is blunted as well.
Okay.
So that's one small suggestion.
So I should step it up on the running.
Yeah, gradually. You don't want to end up with an injury. But,
right.
But make sure, do you have track shoes or you have big...
I have running shoes.
Jogging shoes.
Right.
Yeah, so they have usually a lot of cushion in the heel, which serves a good purpose. But you want that impact with each heel strike.
Okay.
So maybe find less of a shoe and a harder surface to run on. Don't do it all of a sudden all the time. Go to the track, a couple times a week, and then try running on a harder surface a couple times a week, something like that.
Okay.
And you could also, as your body allows you to gradually, with increments at a time, a few minutes more at a time, increase your running time.
Okay.
And that'll help. And then maybe recheck your bone density in a year.
Okay.
And see if it helps.
Okay.
In the meantime, I'm exactly your age, and I haven't even had a bone density test. Why you got it, I don't know. Do you have a family history, or did you have a fracture?
No, it's just that somebody else in my family had a test, and I thought maybe I should have one too.
Yeah, because it's not routinely done in 65-year-old men without a high risk factor. People who have a strong family history, people who are taking like cortisone a lot, people that have been immobilized, and so on. But I think you're eating well enough and getting enough vitamin D in the sun.
Right.
And
to just step it up on the running.
See if that doesn't help.
Okay.
and get that impact. You know, you want to come down with a little jarring. It's that jarring that does the electrical impulses that lays down more bone.
Oh, okay. I'll get back to you on this then.
Yeah, good.
Okay, thank you.
All right, have a good holiday.
Okay, you
Thanks
too.
for
Bye.
calling. Yeah, bye-bye. Let's see. I got my next caller. Line 1 is Jane. Is it? Jane, go ahead. You're on the air, and thanks for calling.
Hi, good morning, Dr. Portner.
Yeah, we lost you the first time, I guess.
I'm sorry about that. It was the tunnel.
Oh, it was the tunnel. What's up?
I'm on my way to work, so I'm a nurse as well. So not just a caller, but a nurse. But I actually wanted to comment on the caller who had the neck symptoms. I did have a similar problem years ago, and I wanted to reiterate your point that you made about the traction and just, taking it like a step back into the more, conservative treatments. And, but I did actually want to also stress that what really helped me, literally get completely rid of my symptoms was just really making a conscientious effort to change my posture.
Yeah, that's a big point. I'm dying.
One of the biggest changes I made actually was changing my posture.
Right.
And
when you say
it made all the difference in the world.
When you say your posture, do you mean like sitting at the computer posture or walking around the street posture?
Everything. Sitting in the car, sitting at the computer.
How did you go about this? Did you know from being a nurse? Did you just know what you had to do, or did you see a physical therapist and they helped you, or do you do exercises specific to posture improvement, or do you take yoga? How did you go about it?
Well, I did actually see a physical therapist at work, and I did. I read a book by Dr. Renee Pellier.
I knew him. I knew this man. Yeah.
Oh, you did?
Yeah, he was a colleague of mine. He's since passed away. But he was a colleague of mine. He, too, was a physiatrist, a physical medicine rehabilitation specialist. And we would meet yearly at our meetings, and we both had an interest in neck and back and arm and leg pain. And back in the day, there weren't that many of us. Most physiatrists were more involved in head injuries and spinal cord injuries and amputations and strokes. There were just a handful of us that were focused on neck and back and arm and leg pain, and he was one of them. He wrote a whole series of books. And, it's nice to hear that name again. And you read his book, and a lot of it had to do with posture improvement. And I think that's a very valuable call you're making, because I forgot to mention it. A lot of people, it's interesting, I mentioned the computer. A lot of people sit at a desk all day and look at a computer all day, and they wear bifocals. So they have to look at this computer screen through the bottom half of their lenses. In order to do that, they have to tilt their head backwards so that they can look through the bottom of their glasses. And they spend the whole day with their head tilted back, and they come to me with neck pain, and I sort it out, and I use traction and whatever I need to do, and they get better. And then they come back in a couple months, same thing, because I forgot to address posture. Or I addressed it, but they didn't take me seriously. And sometimes I actually have them get special computer glasses that they don't have to tilt their head back in order to see clearly their computer screen. So a very good call, Jane, and I appreciate it, and it can't be emphasized enough. I've recently taken up yoga again. I used to do it pretty avidly back a couple decades ago, actually. And I find it so posturally corrective and uplifting, I might add, that I'm often suggesting to my patients not just to be aware of posture and to learn postural exercises, but to take up an activity and start a hobby that promotes good posture, like yoga or dancing or martial arts, they all promote really good posture. So your point is very well taken, and I hope the guy that called me is still listening. Posture could be a big part of the answer.
Exactly. That saved me. That definitely saved me, I think. And I agree. Those books are really good.
Yeah, they are.
I recommend them to my patients, actually. So.
Well, good for you, Jane. Thanks so much for your call. I appreciate it. And
thank you, Dr. Portner.
And have fun at work. Take care. Let's see. I maybe have time for one more caller. Mary, go ahead. You're on the air, and thanks for calling.
Okay, Dr. Portner, I wanted to mention that I signed up for my Humana Medicare policy a couple of days ago.
Yes.
And I asked them to look up your name on the list. And we did look it up in the booklet they have, and there you were.
Oh, really? You know, I'm not surprised, although I wasn't sure of that. Maybe the guy that was called in earlier that got Humana was still listening, and he can come see me.
Yes.
After all these years in this community, you know, I've been here since '81, and I think I've participated with just about every plan by now. And, I'm not surprised, although I honestly didn't know that. So Humana is a plan that has me on their list. You know, even Kaiser has me on their list. They have a Kaiser Plus plan, and it allows the Kaiser doctors to send, in special cases, difficult cases outside of their usual system. And I see patients from Kaiser referred to me, and Kaiser can sometimes pay for it. So that's good to know. I'm pleasantly surprised.
Well, the gal said, the representative said, one of the things is that Humana has negotiated a contract to do the actual billing and everything here locally instead of. And she said that makes the difference, and a lot of the doctors automatically have shown up on their list where they hadn't been before.
Well, good to hear. Okay,
and I might come and see you.
Oh, good. Well, I'll look forward to it. Thanks for your call. I'm going to have to sign off here. Mary, thanks a lot.
Bye-bye.
Bye-bye. That about wraps it up, everybody. I'll have more to talk about next week about the new clinic in Kapolei, and about the new weight loss program I'm starting in January. And I'm hoping that people consider giving a gift of life, a gift of health to a loved one by signing them up and maybe paying for the first month of this weight loss program. Nothing like a gift that gives health and gives life and lasts for years, rather than something that just gets put in the closet after a couple of weeks and you never see it again. And maybe I'll have some more information on how this stem cell procedure goes as well in the coming weeks. Thanks for listening, everybody. Get out there, have some fun, get some exercise, don't eat too much, love each other, and hold hands when you cross the street. Bye-bye.
Thank you for listening to The Moving Body. Hope you enjoyed the show. Remember, if you're having problems with your arms, leg, neck, or back, and would like to get an appointment over at the office on Pecoy Street, you can give us a call, 596-7300. We're open 6 days a week and have a full line of doctors, therapists, EMG, and a great office staff to assist you. We try to respect your time like we hope you respect ours, so people are seen on time. You don't have to expect to spend the whole morning if you have a 9 o'clock appointment. We'll try to see you right then and there. Remember the warning signals that I talk about throughout the show off and on. If someone tells you that it's only your age to live with it, that the x-ray's normal, nothing's wrong, that it's, quote, arthritis or bursitis or tendonitis, but they haven't really examined you very carefully, be cautious about that. Ask for another opinion. If you're told to have surgery, ask for another opinion. If you're told nothing else can be done about it, you want to say, well, maybe you can refer me to another specialist. Maybe they have a better idea. Don't just accept those kind of things. Don't forget to tune in next week, same time, on KHVH. Go out there and exercise this weekend. It's the single most important thing you can do for your health and body. Health cannot be bought off the shelf. Special nutritional supplements is not what's going to take to improve your health. It's going to take a lifestyle change. It's going to take for you to put on some good walking shoes and get out there and take a walk every day. We'll see everybody. Have a good, healthy weekend, and tune in next week. Bye-bye.